We're going to talk with Dina Kelsay. She is the Director of Business Development with Hospice of North Coast. Their website is hospicenorthcoast.org. One more time, hospicenorthcoast.org. And we're going to talk about Healthcare Decision Day, which is today.
Yes, it is.
Today. Okay, what does it mean?
It is a national effort to recognize something very, very important, and that is people putting things in writing to spell out what their wishes are, so that their family doesn't have to guess.
Okay, what would I put in writing? I want to be healthy?
That's assumed.
Okay, we got to get more in depth than that, huh? What would be advantageous to have in writing?
Okay, well, there are several different versions. The one I really want to focus on is called the Pulsed form, but I want to mention the others as well because they may have names that people recognize more readily. There's the 5 wishes. That became, I think, more entered everyone's awareness several years ago with the Terry Schiavo case. And then there's the Advanced Healthcare Directive, and every state has their own form. You can actually do one yourself, and that is one where people spell out who they are naming to make their decisions for them if they cannot express their own wishes.
Okay.
And they usually have maybe a primary and an alternate, and that's great. They also have some things there that they enter about treatments they would consider for themselves, things that they absolutely do not want done, and they can change that over time. People's wishes change as they go through different experiences. But there were pitfalls with those documents, and that is that they are not observed, cannot readily be observed by healthcare professionals, specifically paramedics. And so the Pulsed form, the California Pulsed form, began January 1st of 2009, and it's been revised a couple of times, and we have a new one. Old ones are still in effect if people have those. They're still valid, but we've made the form a little more simple each time it's been revised. And so it's great because it's something that gets signed by your doctor. Once you've filled it out, you have your doctor sign it, and it's your property. And it becomes a standing medical order on your behalf. So any medical professional that it's presented to, they're legally bound by it.
We're talking with Dina Kelsay. She is Director of Business Development with Hospice of North Coast. Their website is hospicenorthcoast.org. That's the website, hospicenorthcoast.org. We're talking about healthcare decisions.